Hello, I'm Chris Salisbury, and today I'm talking to Aziz Sheikh, who was appointed last year as Professor and Head of Department at the Nuffield Department of Primary Healthcare Sciences at the University of Oxford. So, Aziz, welcome.
Thanks, Chris. Great to be with you.
Now, as will be apparent as we talk, you're a very, very busy man. Um, so it's really good of you to give up a bit of time to talk to us. But we'll hear some of the things that make you so busy in a minute. Um, I wonder if we could start though just by talking a bit about your background and how you came to study medicine.
So I grew up in the East End of London, born in Karachi, Pakistan, but was moved to London when I was one. And I guess, as with many Asian households, the expectation was that, particularly as the oldest child, I'd go and read medicine. And the honest answer is I was duly obedient, and that's what I did, really.
I watched the video of your inaugural lecture. You sent me that beforehand, which was really useful. I have to say, I found it really quite moving, really, when you were talking about your experience growing up and your experience of racism and exclusion. And how do you think that influenced your career and the way your career's gone?
So I think it probably has influenced me in a number of ways, but I think the most important sort of lesson I'd take from that, Chris, is all those experiences are that I want to create teams and environments where people are judged on their abilities and their talent, and also recognizing that we're all kind of starting from different places. So um, there may well be the need to sort of create additional opportunities. But so, I think that the way I kind of process those experiences are, I want to be really sure that, I'm not sort of propagating those kind of experiences where people are being marginalized. I'm creating inclusive environments where people are treated with respect, um, supported where they need to be. And I guess this is complicated. It's always a kind of a work in progress. There are so many dimensions to this, but I think it's certainly that's the intent really
Mm.
with the kind of work I try and do.
Do you think it's influenced any of your research themes?
Absolutely. So certainly initially, and this continues. There's been a lot of work around inequalities. Many of us do that. I think we care about that passionately. But I think in terms of there are kind of additional dimensions that uh, I think because of my kind of experiences, my background, I've been able to bring to the mix. So, for example, um, ethnic ethnic or racial kind of disparities, are quite well known about. There's probably less work happening in terms of thinking about the interface between religion and health, for example.
Mm.
And so some of the kind of earlier work I've done.
Mm.
I think what it also does give you, Chris, is a kind of a very good appreciation of the way sort of marginalization or discrimination operates through a kind of an intersectional lens. So, I do have a kind of not a kind of a direct understanding of what it means to be sort of marginalized on the basis of gender or disability, but there is that kind of innate connection there, I think, really, in that sense. So there are kind of parallels. There are variations, absolutely, but I think the core is trying to create more inclusive environments and research that can foster that. And ultimately, what we're trying to do is deliver equitable healthcare, across the NHS and beyond. And that's been a pervasive theme, I think, of my work.
Mm. And your work has covered an enormous number of themes. And in retrospect, you can trace the story. For example, did work on patient safety, and then that you had to link data sets, and that grew into some of your big data work. At least that's how it seems to me from the outside. But as you say, you've written books, haven't you, about caring for people from different religious backgrounds. You've got a big reputation in allergy and asthma and respiratory disease. I hadn't realised how much you'd done on telemonitoring and telecare for people with long-term conditions, and then more recently COVID. I mean, if you had to characterise your career, how do you describe what you do or what you've done?
No, it's not particularly linear, really.
Mm.
So I guess, like most of us in sort of general practice, academic primary care, we've got lots of interests, and I think that's kind of in part reflected uh, in my career. So I talked about some of this in my inaugural. You may have seen of that. So I mean, initially it was around these existentialist kind of questions. I think I was always drawn towards sort of the academic side of things. I think from childhood. So I was very fortunate to land one of the 1 year London Academic Training Scheme fellowships at Imperial, and I think this is where our kind of paths crossed for a while. That was a brilliant taster. I mean, I kind of thoroughly enjoyed the experience, and I remember George Freeman interviewing me for the post, and George has recently reconnected, so I'm
Mm.
looking forward to meeting up with him. And so I mean, that confirmed for me that this was something that I was interested in. But there wasn't sort of any follow-on opportunities. So I did then apply to the BMJ as an editorial registrar. And the task that was set prior to the interview was to put together a draft editorial on patient safety, which I did. I mean, subsequently, Imperial did extend my post, so I withdrew from that. But that was I mean, for me, that was completely eye-opening. I mean, I think we've all made medical errors in our lives. It was the first time I'd ever seen a kind of an open discussion with a view to kind of promoting learning. So inherently got very interested in that piece of work, even though, I mean, I kind of pulled out of the BMJ experience.
Mm.
It was the start of the start of the patient safety movement. It all kind of largely originated in the US at the Harvard malpractice study, all centered on hospitals. So I thought there were dimensions from primary care where there was, particularly in the UK context, much more volume of work. So I was able to kind of, I mean, engage with that, interface with thought leaders, and eventually, I mean, ended up working very closely with Sir Liam Donaldson, and Liam has been the WHO patient envoy for patient safety, and continue to work with Liam. So that was kind of one side of things. The work in allergy and respiratory, again, wasn't particularly planned. But, you know, Sangeeta and I had a first child. He had what eventually we worked out was anaphylaxis triggered by milk and egg allergy. Didn't have a clue how to manage it, despite the fact that we were both GPs.
Mm.
There was very little awareness of allergy. It wasn't part of our sort of undergraduate curriculum, and actually wasn't part of the curriculum anywhere really in the UK, one of these Cinderella specialties, because it sort of transcends kind of organ systems. And so that led to kind of work with the Royal College of Physicians, with the House of Lords, various select committees to try and develop capacity, because the experiences that we had were being replicated, I mean, all across the UK and perhaps beyond. So that was an important strand of work. One of the things I was interested in, I'd done a master's in epidemiology at the London School, which I loved. It was a fantastic experience. But I was hearing anecdotally from patient groups, etc., that anaphylaxis was increasing in incidence. But if you've got a condition which affects maybe perhaps around 1 in 1,000 of the population, you can't do your standard epi using sort of questionnaires of the kind that we're doing at the time. And so I thought maybe a kind of an opportunity to kind of look into this was using some of the large data sets that were beginning to become available. So we did some time trend analysis using hospital episode statistics, looking at the incidence of anaphylaxis as being presenting to hospitals, showing a very clear sort of time trend. That work was then extended. And I think the lesson I took from that was that these systems become incredibly powerful, really. I mean, all the data coming out of the back end of these
mm,
systems. And then I think maybe the last bit of the kind of narrative in summary is that I'd moved to Scotland at the time, so taken on sort of moved into John Howie's next department, was recruited by John Saville and David Weller. And the tender came out to lead the evaluation for the National Programme for IT, or the headline deliverable, the NHS Care Record Service. So I was very fortunate to kind of win that tender with a UK-wide team. And so we did a kind of of the moment piece of policy relevant work. It was quite a hot potato to handle at the time.
mm.
But it was part of this kind of journey to the digitisation of health systems. The UK was quite different from the US at the time. The US began in hospitals, we began in primary care. And so the focus for Tony Blair's kind of modernisation strategy was to digitise hospitals. So I got involved in the kind of health IT, health policy side of things there, and eventually kind of decided I was so involved in so many kind of policy related deliberations that I needed to kind of study health policy. And so I did a Harkness Health Policy Fellowship, and I did that under the mentorship of David Bates, a fantastic primary care academic based at Brigham and Women's at Harvard, but also really probably the world's leading authority in health IT. But at the back of all of this, I mean, I knew the IT was going to be sort of important. It sort of supported through the order entry systems or decision support that we now take for granted, or the order sets or whatever else. But the most valuable bit of this was going to be the data coming out of the back end.
Mm.
It's a focus on health data sites. So none of it, Chris, particularly planned, none of it particularly linear, but it's been a lot of fun along the way, really, and worked with some brilliant colleagues.
Do you think, which of them do you think will have the biggest impact? If we look at this in 10 years' time, what do you think you'll be most associated with?
I think the health data science, really.
Mm.
Yeah. Because my vision for this, Chris, is that the data, particularly once you link up with sort of non-core healthcare data assets. So, for example, we've got ad hoc linkages with educational data, pollution, meteorological data, welfare data, taxation data, etc. The kind of range of questions that you can begin to answer, you're only limited by your imagination.
Mm.
But I think the way we need to be thinking about this are these data being deployed to support and inform policy making and evaluate policy, because policy at the end of the day is a bit of a punt, really. So it needs iteration, it needs evaluation. So those kind of macro level questions, which at the moment nobody's really looking at, or we're looking at sort of retrospectively many years down the course.
Mm.
I think in terms of organizational efficiency, safety, quality, that work is kind of progressing. We're doing that in primary care, it's happening in hospitals. But I think also a massive change coming down the track is we're moving to this era of Internet of Things. We're generating data, a digital footprint all of the time. How can we actually begin to use those data, particularly to support in real time people living with long-term conditions?
Mm.
And I think that's kind of it can't be this involves work. It involves kind of aligning with people's lives, with people's workflows. It's not a kind of a simple panacea. It's not a plug and play. I think there's one heck of a lot of work, but I think we can move to a kind of a next generation health system that is supported by data, a macro, meso, and a micro level, really.
So you've gone to these different fields for a variety of reasons, sometimes personal reasons, like your child having allergy, sometimes your personal interest, sometimes just opportunities because of where you were at the time.
Mm.
Is that what if you had a young academic in training now that you're supervising, would you encourage them to follow their curiosity in lots of different directions, or would you say get a niche and just stick to one furrow and become a real expert?
Yeah, so I mean, I do have the privilege of supervising many fantastic, bright young colleagues, I mean, from across the world, and some not so young as well, which is a lot of fun. I kind of thoroughly enjoy it. I guess in the kind of model that's traditional in UK healthcare and by extension many other health systems is a kind of a T-shaped model. So you kind of generate that depth in a really focused area. And then you diversify as is appropriate. So that mastery may take sort of 10, 15, 20 years before you diversify. That is an approach, and that may suit sort of a lot of people. It's clearly not what I've done. I think the other approach is really work out what your value set is. I mean, what is it that you enjoy doing, and kind of really kind of piques your curiosity. And then can you find some outstanding mentors really to kind of help you along that journey? So, I maybe if 20 years ago, I would have thought it would be very linear, but it's been anything but that. But I think it's been a lot of fun along the way. I think the most important thing is being able to work with absolutely fabulous colleagues. And not all of it's going to sort of have an impact or translate, but I mean, I hope at least some of it does, really.
And that is interesting that a number of people I've talked to, we often give people advice to get an area of expertise and stay within your lane. And yet a lot of very successful people actually don't do that. They follow the things that really matter to them, that they're interested in. And often that goes in different directions. Alongside the breadth of your publications, the thing that's really notable is just the volume of them. I mean, you've been an author of several books, over 1,000 or over 1,100 papers. And I just looked at, in the last 5 years, you've been an author on over 400 papers, which works out at about one every 4.5 days. And at the same time, you were leading the Usher Institute in Edinburgh, you were editor-in-chief of a journal, you were directing the Asthma UK Centre, you were leading the Eve surveillance platform, you're advising governments. I mean, and that's just some of the things that I know about. How on earth do you do it?
I think one is, I mean, if you enjoy it, it's not really work anymore. That's one. I think part of the kind of secret is having large networks of collaborators, and I think for those to be meaningful, it has to be reciprocally beneficial. So, but I do, I mean, work with brilliant colleagues all over the world, and that helps. And then I think it's finding the synergies, and I think in my head I can find those relatively sort of easily. I don't think they always make sense to the external world or even to my wife. But yeah, I mean, I can kind of find the kind of intersections with those, and maybe it's just the way kind of I'm configured. But yeah, it's busy, but fun as well, really.
So some people get a lot done by not focusing on details. And is that you, or are you someone who actually does get down to the detail?
No, it's definitely not me.
No.
Well, I mean, I definitely like the big picture stuff. As anybody who's worked with me, I'm correcting grammar and I've got my bugbears around abbreviations and all that kind of stuff. And so, yeah, I mean, it's that kind of, I'm a detail person as well.
So you must also, what would your advice be to all those academics who've got a paper that they've been meaning to get round and finish writing that sat on their desk for months? And meanwhile, you've written about 15 in the same time scale.
I mean, I don't think this is really about volume, Chris. I mean, this really is not a volume game. It's a quality pursuit, really. I think fundamentally, in part, it's kind of trying to work out. I mean, is the work that we're doing? I mean, there'll be different answers for different papers, and is this kind of confirmatory? Is it incremental? In which case, then, I mean, I think getting a paper that is good enough and putting it into a non-kind of competitive journal makes a lot of sense, because I mean you could go around the houses and spend a lot of time doing that, but then you have to work out which of your kind of publications that you're involved with are actually likely to be transformative, and those typically will involve then 10 or 15 different iterations before you sort of put them to one of the bigger journals. But I think it's in part working out, I mean, what kind of a contribution is these? They've all got value.
Yeah.
But where do you kind of particularly invest your time and effort, really, I think?
Yeah. Which are the big ones that are really going to make a difference? And yeah, absolutely. So then last year, as I said, you became head of the Department of Primary Healthcare Sciences in Oxford, which is almost certainly the leading centre for academic primary care in the world, really, with over 600 staff. So that's an enormous responsibility. How does it make you feel?
I think it's an incredible privilege in so many ways, Chris. It's a fantastic department. I'm very, very grateful to those who've kind of built it up. And I mean, obviously there are leaders. There's Godfrey Fowler, there's David Mance, Richard Hobbs, and I mean, I think they've done a phenomenal job. They haven't done it themselves. There's kind of a whole leadership structure underneath them. I mean, that said, I mean, I've come from kind of leading a department in Edinburgh, which was, I mean, ahead of Oxford out of the blocks in terms of developing academic public health and primary care capacity. Similar kind of size, similar kind of footprint. So at one level, it is a kind of a sideways move. But Oxford obviously has got far more convening power. And so it is a privilege, and I work with a fantastic leadership team. I just appointed sort of for deputy heads of departments. I believe in a distributed leadership model. We've got a fantastic team of leaders there in Chris Butler, Chris Griffiths, Kathy Pope, and Sophie Parks, really. So as deputy heads, I mean, brilliant administrative or professional services colleagues. So this is a kind of a team play, but what I'm very keen to do is how can we use the convening power, the critical mass of this department to strengthen primary care across the UK and globally. We've got some brilliant departments in the UK. We've got other fledgling departments. So we had a piece recently in the BJGP around this, discussed with the Medical Schools Council. And globally, in many parts of the world, this is just beginning. So I've just come back at the weekend from Pakistan. For example, academic primary care is just really taking its first initial steps. So what I'm keen to do is, I mean, I think this department, this privileged position comes with responsibility, and that responsibility is not to disrupt, but rather to kind of support and develop capacity even across the UK. I think if we were just to suck in the talent from across the UK and in the process, I mean, help implode other departments, that would be the wrong answer as far as I'm concerned. And certainly as I moved from the Usher, I've tried to leave that as intact because it's a brilliant place. Kathy Sudlow, who's coming to position, will hopefully just make it even better, really. We need strong applied translational departments and many more of those across the UK and globally.
Absolutely. So alongside your stellar career, you were awarded an OBE in 2014 and then a knighthood in 2022. And you talked in your inaugural about how your parents, they were graduates, they worked in factories and they had a market stall and you helped with the market stall and they really prioritised education. I mean, how must they feel now seeing you being head of department in Oxford? They must be incredibly proud of you.
Yeah, no, and I think they are very proud. But yeah. So I mean, I think some of what I do is kind of, I mean, they don't really quite get anymore.
Right.
With my phone, but I think yes, and part of the reason, and I've just been very open about this in various contexts, was that both my wife and I had elderly parents in and around London who needed sort of much more
mm,
input. It was very difficult doing that
mm,
in Edinburgh, and so I think it was. Sadly, my father-in-law died 4 months ago, and my
mm,
dad died 3 weeks ago. So, but we were able to be there a lot more because of the fact that we were in closer geographical proximity. So,
mm,
I think I'm just completely content that that was the right move, really, for those reasons as well.
mm. So, what are you interested in outside medicine? If you have any time for anything outside medicine?
Yeah, so family matters a lot to me.
Mm,
Uh, I, I mean, the faith dimension matters a lot to me.
mhm.
I do enjoy playing sports, particularly racket sports, so table
Right.
tennis, badminton, tennis, a bit of squash. I enjoy watching cricket, although supporting Pakistan is one heck of a heartache, really. Yeah.
Yeah.
And enjoy watching football as well. I mean, I kind of would love to play it, find a bit more time to play it, but yeah. So sport, I enjoy, and I think it's got a lot of parallels with kind of elite academia, actually. I think. Yeah.
It was really interesting talking to you now and watching your inaugural. You come across to me as someone who is very modest, really, despite all the things you've done. And also, you've talked about family, you've talked about the importance of values, and you also described yourself as an introvert. And these are not characteristics we usually associate with, very high-profile leaders. Do you think this has affected how you lead?
I mean, I think, Chris, to my mind, we as individuals and as teams or departments are always a work in progress.
Mm,
Um, I mean, in the round, there's always people who are doing absolutely brilliant jobs that I kind of aspire to emulate, whether that's being able to chair a meeting or public speaking or the quality of the research that they do or the way they kind of look after their juniors and their mentees. So I think there's always kind of a, a lot to learn. I just kind of inherently believe in team-based approaches. I think if you can draw on sort of a range of talents, and equally, I mean, having those, I mean, in those decision-making circles, people will challenge coming from different worldviews.
mm,
We probably make better decisions. We kind of can get so much further together. So yeah, I mean, has it affected the way I kind of do things? I prefer not to be the centre of attention. I'd much rather that we kind of celebrate. I mean, so much of the talent that is coming through, and we're kind of phenomenally blessed with the talent that is coming through across our institutions. The more airtime we can give these guys and help them establish their careers, the better. As far as I'm concerned, that's what we try and do. I mean, maybe we could do it better, but that certainly is the hope, really. I think.
those are really great lessons. Aziz, thank you so much for your time. You're starting a new and exciting chapter in Oxford, I guess, and we really look forward to seeing what goes on there. Thank you so much for your time, um, and good to talk to you.
Lovely to speak to you, Chris. Thanks so much.